Hello, everyone. Michele Crosmer and Dr. Hashmi here with Plant-Based Kidney Health. And the question for today, Dr. Hashmi, is what should people do or not do leading up to them getting their blood test drawn?
Yeah, so this is a really complex question because of the fact that on the one hand, what we're really interested in is trying to get an idea of the most accurate blood test possible. So what does that mean? On the one side, what we want to know is what is your creatinine production naturally going on so that we can measure that in the blood and get an idea where your kidney function is at. So for example, the things that would affect that would be things like exercise. If you exercise, you increase the acid in your blood, you're going to drive more potassium into the blood. Of course, you're going to break down some muscle, you're going to raise your creatinine level. So therefore, if you go in and do a blood test shortly after, or let's say you exercise vigorously the night before, and in the morning you do your blood test, it may look like that your kidney function is worse, even though it's not. So that's the first thing. And then on the other hand, the challenge that we have is some people have a really hard time finding their veins. So oftentimes, if you look at just about every website on how to prepare for a blood test, they'll tell you drink a lot of water before you go in for the test. Now, this is the problem. If you drink a lot of water, you're going to dilute your levels of potassium, your levels of creatinine. All the blood tests are a concentration. So if you're very hydrated, you're going to dilute that. So it may make it look like your kidney function is better, even though it's actually not. So, we try to use, for example, ratios to be able to adjust for the volume aspect. And there's other things than creatinine like cystatin C and etc. that we use. But the bottom line here is if you're used to drinking 7-8 glasses, then stick to that 7-8 glasses. Because if you change it up just for a blood test, then we don't get an accurate idea. Definitely for exercise, that's not something that you want to do, the night before or the morning of the blood test going on, because that can potentially affect it. And then the real challenge is, what about all of these medications that affect your blood results? So for example, if you're on antibiotics in the class of cephalosporins, those can either increase the creatinine or decrease the creatinine, so they can have different effects going on. The answer to that is if your blood test comes out and it's not in line with where it usually is, the number one thing is to repeat it. So if you're on any antibiotics at the time, let's just recheck it. Another thing to remember is there are certain medications used for cholesterol, for example, called fenofibrates. And what we know about fenofibrates is they can artificially make it look like your creatinine is worse or higher than it actually is. But if we know you're on a fenofibrate, which by the way, we always stop patients because we have better options than using fenofibrates. But if you are on a fenofibrate, we just want to be aware of that. And if we're worried that your creatinine rose because you started a new drug, we may ask you to hold it. But what you can do as a patient is just two things. First, don't exercise immediately before or the night before going on. Second is whatever hydration you're doing, try to stay at the same level. Please don't try to overhydrate just for a blood test. It will make the blood test look better, but it doesn't actually mean your kidneys are any better. Thanks so much for watching, guys. Send us your questions and we'll be sure to address them next time.